All right, thank you so much for the introduction. So good morning. My name is Heather McNeil, a PhD candidate in the School of Public Health and Health Systems.
Hi, I'm Peter, and I'm just a plain guy who's retired.
And we're so grateful to be asked today to come and share with you. So we were asked to present on the SHARP group, and Peter and I chatted a little bit about how we would do that, and we decided that the best format might be that I explain a little bit for you folks about what this group is, how we came to establish this group, and then Peter would share with you some of his personal reflections as an active, longstanding member of the group, just by way of an agenda for us today. So, importantly, why did we decide to create the Seniors Helping as Research Partners group? Well, it all started with our research that our supervisor, Dr. Paul Stoley, was leading, called the Info Rehab Transitions Project. And this work, which you can find out more about by looking at the Geriatric Health Systems website, really focused on the experiences of people transitioning who had experienced a hip fracture. So they were transitioning throughout the healthcare system. And because they were using qualitative methods, they were able to find out really in depth what the experiences of these folks were. And they found out that people wanted to be engaged in decisions in the healthcare system at a clinical decision-making level, but also beyond that when we think about research and planning. But they weren't finding that they had the opportunity to do that. So, to borrow a phrase from this morning, the serendipitousness, is that right, Dr. Murray? Around the same time, I was coming into my PhD, and there were folks already in the program, and they had started to think about, well, how could we start to engage better with older adults in the community? So we were able to brainstorm about what the vision would be, what the mission, what the goals would be, and by making use of, and this is a pearl of wisdom, by using the relationships and fostering the relationships that you have in the community, we were able to work with the Guelph Wellington Seniors Association and the leaders there, who, as you'll see on the screen in the bottom corner, we're working to create a healthcare forum. So the goal was to bring in community members, seniors in the community who had an interest in health, and it was entitled My Healthcare Forum, Seniors in Control. So you can imagine that that would draw in a group of people from the community. And they had another pearl of wisdom, a very well-recognized speaker, Dr. Samir Sinha, which I'm sure many of us who study aging are aware of. And so because we were able to partner, we had a group of over 200 seniors who came to this event who were interested in aging. And so we were able to speak with them about how they would like to be involved. And that was really the big kickoff event and recruitment for our Seniors Helping as Research Partners network. And so to date, we have just over 70 members who we partner with, and we're always recruiting for more members from the community. So if anyone has an interest, please feel free to come and chat with us. And you can see on the screen that we have our goals. So that would be another pearl of wisdom, to really think about what is your vision, what is your mission when you're trying to work with older adults in engaged research. And we started this group, and then we thought, I don't know if we know how to do this in the best way possible. So there was an opportunity through the Technology Evaluation in the Elderly Network, which I'm sure some of you are aware of, an NCE that focuses on improving care for the frail elderly. And we were successful in applying for a call for a knowledge synthesis, which we entitled Choosing Healthcare Options by Involving Canada's Elderly, or the Choice Knowledge Synthesis Project. And what we did with this was we incorporated participatory methods. So we were trying to learn about engagement, so we engaged with our SHARP group and also with other community organizations that are interested in activating patients and older adults. And so you will see here that we have some papers published on the results of this, and we work actively to try to improve our engagement efforts all the time. We use the information that we found through the synthesis in the literature, and we continue to collaborate with our SHARP members to improve how we can engage together in the SHARP network. And just by way of a bit of flavor for you, so that you don't have to grab the paper right now on your computers and read it right now. We came up with a model which we co-created with older adults and caregivers, as I mentioned, which really looks at how you can engage with older adults in healthcare research and planning. And so you'll see that we have the underlying idea of understanding the environment in which you are going to engage. And what we came up with was rather a stepwise model where you first begin by planning what your engagement initiative will be. And then a really key finding that we found from this project was establishing a relationship. No matter how long the engagement opportunity will be, it was really important, these hands-on, concrete, face-to-face meetings where you talk about what your engagement goals would be and how they would be achieved, and you work together to do that. So as I've given you the paper citation, I feel free to go and check that out. And now that you know a little bit about what we do and what our goals were and how we came to be, I'll pass it over to my co-presenter here to tell you about experiences with the SHARP group.
Well, being a SHARP guy, I awoke one morning and realized that I was a senior. What do seniors do? I went out and visited many seniors to see what they do. Well, when they get together, they talk about their aches and pains. They sure like to bitch and whine. What do they do to stop their whining? Nothing. They want others to do something to improve their lot. I dreaded to be in that situation and thought to myself, what can I do? Just then, I met two young ladies, Jacoby and Heather, from the University of Waterloo, who were trying to dig up some seniors to study. But they wanted the alive kind. These young ladies were at a disadvantage because they were young and did not really know what a senior was and needed seniors to help them understand. Now I had a double advantage over them. I was young once upon a time myself and could relate to that. And once I was a senior and I could relate to that. Why not volunteer to help these young ladies out? Because they needed to study as senior. That was SHARP. The reason I support the SHARP program is that it is being proactive and being directed in a positive direction. It's a lot of hard work, and it is being done by young university people who are full of energy, work that is being done for seniors who have no energy but to whine. We all have a stake in this if we all hope to see senior years. I'm glad to support SHARP so that I can have steak and wine in my senior years. Thank you for listening to someone born in the year of the monkey, and I wish you all to be lucky enough that someday you too will be a senior.